Suresh sir?
One minute. I'm asking my students to join.
Okay, sir. So I will be introducing the speaker. Veera sir is non-joining.
Okay.
Okay, thanks. So, you'll wait for a few more minutes for the participants to join, ma'am.
Access, shall we begin the session now? I think they
Yes,
will.
sir. Yes, sir. Sure. Yes, sir. Uh, I request Suresh sir to welcome address and followed by them I will be giving the introduction. Yes, ma'am. Yes, sir. Thank you. Over to you, sir.
Very good evening, one and all. And today we are going to have a webinar session. I think it is our 230th webinar session. How to cope up with depression. And today's topic is one of the important topic I can say as per World Health Organization. They listed out India is one of the most depressed country in the world. I hope today's session will be useful for us, including for me. I welcome today's speaker, Sanika, on behalf of the Department of Psychology, American College, Madurai, and our associating institution like Madras School of Social Work, Chennai, M.H. Chellamathy Institute of Mental Health, and Redmond Education Psychological Research Center. I welcome you, ma'am, and I welcome all the participants who were joined today. I hope this today's session will be very useful for you. Please listen to the speakers' inputs and then share your experiences at the end of the session. I welcome you all. Over to you, Akshaya.
Thank you for the opportunity, Suresh sir. So I take the pleasure to introduce our speaker for the day, Sanika ma'am. She's a competent clinical psychologist and has experience in HIV and tuberculosis counseling and has worked as and is right now working as a freelance counselor to handle various cases in individual and capacity with various organizations. She has done her master degree in clinical psychology from SNPT Women's University, and she has work experience as a clinical psychologist and counselor at Government Hospital, Thane Mental Hospital, JJ Hospital, Nayan Hospital. She has also attended various conferences and seminars and has attended various seminars on oncology with Sanjeevani Hospital. And there is a lot of information to share about her. So due to time constraint, I will allow the speaker to take over the session. We welcome you, ma'am. Over to you now.
Thank you, Lakshmi ma'am, and thank you, Suresh sir, for inviting me here. It's my really privilege to be on the dais and present myself. Thank you. Okay, so I'll be sharing the screen, ma'am.
Sure.
Yeah, so this topic is very important as we are in this pandemic, as we are locked down at home, and as it is a very it is very mandatory as it's very mental health week and mental health month. So the topic for today is depression. So it's exactly what is depression, how to cope up with depression. We know
Sorry, ma'am.
many people.
Excuse me, ma'am. Your screen
Yeah.
is yet presenting. We couldn't see your PPT, ma'am. Yes, now it is okay, ma'am. Yes, yes. Kindly make it as a full screen, ma'am.
Okay.
Thank you. No, ma'am.
Yeah. So as we can just a moment, ma'am. It's not full screen, right?
Now it
Now,
is, ma'am. Yes, ma'am.
okay. Yeah. Many of the individuals today are going through depression, stress, anxiety. All the college students, maybe let it be adults, let it be old age, as everybody's trapped in home. So what is going through their mind? What are their thoughts? What are their feelings? What are their emotions? So we are going to cover up in this session. So the very basic mental health today, what people are suffering is through depression. Depression, getting depressed is okay, but not seeking depression is not okay. To get negative thought is okay. Now, exactly what happens in depression, we'll be looking at each slide. What is and how to cope up, even we'll come to that. So, depression is a mood disorder that causes a persistent feeling of sadness and loss of interest. Also called major disorder or clinical depression. It basically affects how you behave, how you think, how you feel. And it also affects majorly your physical problems. But as about depression, depression and feeling sad or feeling very irritable has a very different components. How can we come to know that person is going through depression? Depression is marked by depressed mood most of the day, or particularly whenever you get up in the morning, uh, individual has lost interest in their activities or are not willing to do any sort of work. Depression, mental disturbance, typically with lack of energy, difficulty maintaining and concentrating in interest in work. Suppose if I want to do some work and I'm not willing to do that work. Why am I not willing to do that work? Is because my mind and body is not along with me. Feelings of hopelessness, I'm having the feeling of sadness. But very important to see at times, depression is very common. It is very common in each and every human being. But it also has a severity, whether the depression is severe, whether the depression is normal, whether the depression is mild or moderate. So we'll carry forward with each of the perspective how we can note that a person is depressed or a person is going through depression. Okay. So what is the difference between depression versus sadness? Sadness, when we say ki, anything, or I'm feeling sad, I'm feeling happy. So sadness is an emotion. It's a feeling.
Excuse me, ma'am. I'm sorry to disturb.
Yeah.
Your screen is actually not moving. I'm not seeing your screen. Like slides are not moving. So
Just a
can you
moment.
stop sharing, ma'am? Shall I share it for you? And
You
also
can
your
share it
voice
for
is,
me.
yes, ma'am. Kindly stop sharing, and also your voice let it be more louder, ma'am. So some of the participants had that issue.
Yeah,
Okay, ma'am. I will
sure.
just kind
Am I
continue.
audible now?
Yes, ma'am.
Am I audible now?
Yes, very clear, ma'am.
Yeah. Thank you.
Yes, ma'am. You can continue the session, ma'am. I will be sharing the screen.
So, as we said, what is the difference between sadness and what is the difference between depression? Sadness is a feeling, sadness is an emotion, but depression is a disorder. There is, yeah, I'll just come back to PPT where it's clearly significant here. Yeah. So when you're sad, the individual go to talk, individual is okay, individual can do the particular things in a particular way. But when an individual is in depressed state, exactly what happens? There is lack of concentration, there is headache, there is insomnia, there is individual couldn't focus on what the individual is doing. Most of the time, the individual is depressed. Most of the time, individual is unhappy. When any of the individual, where the person is going through depression, you need to go and ask them out. How are you feeling? How are you? That is most important component. Okay. So yeah, so sadness is the feeling of sorrow or unhappiness. Sadness and depression have similar reactions longer than sadness. Sadness will be for a minute, for a moment. Sadness will be temporary. Depression is not temporary because feelings are it does last for long. And when we say that I'm going through depression or any of the individuals going through depression, the very basic thing is that depression can affect our mood, like sometimes being sad, sometimes being angry, sometimes being irritated, sometimes it feels as like we're drained. Nobody is there to talk to us, or nobody is there to share. But if this is happening constantly from weeks to months or a year, then we really need to take in concern that a person is going through depression. Sadness, as it is here, sadness doesn't last very long. It can be something that makes you sad, and eventually you can get over it. Sadness is like, I am feeling sad right now, but now next moment I'm normal. Yeah, so this is sadness, and this is the difference between depression and sadness. Next slide. Hello.
Yes, ma'am.
Lakshmi ma'am.
Yes, ma'am.
Yeah, ma'am. Next slide. Yeah. So who is affected by depression? Now, am I audible?
Yes, ma'am. Yes, ma'am.
Yeah. Yeah. So depression is 1 in 10 Americans suffer from depression. As now it is given Americans suffer. No, we all suffer. Today, 95% of people are going through depression. But it's the illness that affects both our mental illness as well as physical illness. Frequently, depression can come in the form of genetic, psychological, or environmental factor. So anything can contribute. It's important. Someone is working hard, he can get depressed. Or somebody is having some fight at home, so he can get depressed. No, depression can hit you in forms. Yeah. So it is very important to know exactly from where the depression is occurring. What is the cause route that the person is going through? Slide. Now, what are the facts about depression? The for the very most common fact, one of the most common illness found in human beings. Second, depression can be serious and sometimes it can be chronic. Now, when I mean to say chronic is depression can be lasting long term. Women are 2 to 3 times more likely to fall victim to this mood disorder than in men. What happens sometimes? Women shares everything. Women is very sensitive in behavior, but they tend to vent out their feelings, vent out their emotions. But men's they do not do so. So we need to take care of both the genders, whether it is a child, whether it is a women, whether it is a male. Okay, depression tends to run in the families. It is not important if one person is going through depression, then every person will be going. But when we know that the person is going through depression, we need to understand from where the depression is coming, whether it is genetic or whether it is from peer group or friends group, or whether it is from any other members who's been suffering in the family. As we can see, depression affects more than 7 million Americans each year. This is the data of an America, but as compared to America and India, India has the highest rate where people are going through depression. Ma'am, next slide. Okay, now what happens to the brain? Exactly how does this depression struck us in the brain? And what particular lobe affects, and how does it affect our cognition, our day-to-day living, everything? Okay, so depression may be caused by episodic misfiring of areas of the left frontal lobe. So as we can see, there are four lobes: frontal lobe, parietal lobe, occipital lobe, and temporal lobe. Now we talk about daily routine activities, what we do, or daily routine household chores, what we do, how our brain works, and what happens when, if the person is going through depression, what exactly lobe does that work and how does it affect our brain. So the person is going to face these things. In the frontal lobe, where the executive function work, there will be thinking problem. Person cannot plan. It person will be having problems making decisions in any things what the person is doing. Okay, person will be facing issues with behavior, be having, as we motor cortex. So your movement, your body movements will get affected. You will feel weak, you will feel down, you will feel stressed, you will feel like I'm feeling empty, I cannot concentrate on what I'm doing, I'm feeling low, your sensations may not work. Then come to parietal lobe. In parietal lobe, what are the things what we use or what is there? The very important is perception, the way you perceive the world, or the way you sense the, or the way uh, day to day you interact with other people, your arithmetic, your spelling. Okay, occipital lobe, the way you see. So the your vision, it can affect your body, because where else you will sleep a lot, you will feel like eating a lot. Temporal lobe, very important, hits your brain is your cognition. You will have memory problems, you will not remember what I'm doing or what am I supposed to do. You won't understand anybody's language, like what is this person feeling to say, or what is this person saying. You won't get certain words, what. So the moment you find any individual going through this or finding problems, such problems, you can sit and ask that individual, are you okay? Are you going through any of the any of the problem in your life? Okay, next slide. So this is what happens in the brain. These are the brain changes that we go through when the person is in depression. Yeah, next slide. Okay, so what are the different forms of depression? So there are very many different depression. First of all is major depressive disorder or major depression. How can we figure out what is depression and what are the subtypes of depression? I will explain you, no doubt. Major depressive disorder is merely most of the time or most of the day, sometimes 1 month, 2 month, more than a month, if you're feeling low, if you're feeling depressed, if you're feeling down, if you're feeling sad, if you're feeling I'm not able to get up, I don't like to eat, if some of the person is crying whole day, this all comes under major depressive disorder or major depression. Dysthymic disorder or dysthymia, it is comparatively a depressive mood disorder, but it lasts not more than 2 months. Okay, minor depression, when we talk about minor depression, here it comes about psychotic depression. Now what is psychotic depression? Psychotic depression is subtype of major depression that occurs When a sense of depression includes form of psychosis. Why psychosis? Because along with depression, many of the patients go through psychosis as in hallucination. Person can hear somebody's voice. Person can see somebody's walking around them. Okay, hallucinations, delusions. Then they have impartal in their reality. They feel like I'm not here. I'm in some other I'm in some of the other world. I do not resist here. So that is depersonalization and derealization. A person is going through sadness, emptiness, feeling of loneliness. We are here to help them. Person is coming and saying that I'm going through this. You should any let it be any person. We should go. In our India, it's a taboo, but long here to keep like if he's going through depression, that then I'm not going to help them. No, it should not be that. In fact, when you come to know that a person is sitting in depression, we should be first one to go and sit and talk to them. Then comes postpartum depression. Postpartum depression, after they give a birth to the child, everything affects their mood, their cognition, their feelings, their thoughts. So this is postpartum depression where most of the women face after they give a birth to the child. Second comes seasonal affective disorder. When we talk about seasonal affective disorder, this is very rare. This is not found in India, but mostly it is found in outdoor region. As in seasonal affective disorders, it's a one type of depression where the individual is going through certain period of time. Maybe that must be winter, that must be summer, or that must be cold regions. But it will only prolong for that particular period of time. The very most common depression is bipolar disorder. Now, bipolar disorder is a form of depression that affects mood. Sometimes you will feel very happy. Sometimes you will feel very sad. Sometimes you will feel that I want to be crazy, like I want to be out of the world. And sometimes you will again feel that I don't want to get up and I don't want to do the work. So, what is happening basically? Your intensity of the mood is not balanced. Sometimes it goes up, sometimes it goes down. So when you think if this form of depression hits anybody's brain, you need to go and ask that particular individual. Okay. Okay. Now, what are the most common symptoms of depression? Now, this is a very important slide. When you will come to know that, you can ask them this particular things. So these are the feelings that person is going through. These are the emotions that person is experiencing, and these are the thoughts that person is getting when the person is going through depression. So person will feel feelings of hopelessness and helplessness as hopelessness. What is helplessness and hopelessness? Where you don't want anybody's help. I am okay. I don't want your help. Hopelessness is I don't want to do anything. I don't have any hopes to live anymore. When you come across this thing, I don't want to leave. I am not feeling to leave. Something or something or bad is going into my mind, or I'm not liking anybody. This is a symptom of depression, sign and symptoms of depression. Feeling useless. I'm not good. I'm not worth. I should not be here. Why am I here? Nobody likes me. I am very bad. People are judging me. No. Whenever you should be open to everybody. Do not be judgmental. Be non-judgmental. It is okay to get negative thoughts. It is okay to get angry. It is okay to get sad. And it is okay to cry. The very important thing. When you see the signs and symptoms of self-hatred, constant questioning of thoughts and actions, okay, reassurance, feeling guilty. Have I done this wrong? Has what if I do, and what if these people think about me? Okay, individual going through depression will have a lot of energy and motivation. Self harm. You even need to ask whether the person has self-harmed themselves, or whether the person has attempted suicide. The very major cause of depression signs and symptoms is suicide, self-harm. Even now there are self-harm also has the methods, so by taking poisoning or by hanging oneself. When you think these things are important to ask the person. Loss or gain in weight, physical symptoms of depression, difficulty with getting off to sleep, and other things, agitations and restlessness, loss of sex drive, finding it impossible to concentrate, and you tend to forget. If I want to do this job right now, if the work is allotted to me right now, and I immediately forget after 2 hours, there has to be something problem. So individual who are going through depression, they have this all signs of symptoms where we need to figure out a sense of unreality. Sense of unreality is, I am here, I am present here, but I'm not here. I'm talking to you, but I'm not talking to you. I'm not physically. Okay, that's sense of unreality. Physical aches and pains. Whenever you will have severe body aches, whenever you will have throat pain, you will have headache, severe headache. You will not feel like, okay. When you will have suicidal ideations, I don't want to leave. I feel that I'm worthless. Okay, these are suicidal ideas. And then to eat or drink. The person is not eating properly. The person is not drinking properly. The person does not want to uh, be active in any. Okay, delusions and hallucinations. Delusion and hallucination. You see or you hear about the voices, or you see something is going wrong, but it is not there. Okay, so those are delusions and hallucinations. We'll go further. About depression. Depression does not come in one form. Depression comes in multiple forms. As we say, depression also coexists with such illness. So, what are those illness? PTSD, post-traumatic stress disorder, where the person has gone through trauma, life event which is grief or loss, anything. Depression can even hit them, or people who are going through OCD or any sort of fear or phobia. Okay, panic disorder. Panic disorder is like having anxiety, having too much worry, having too much stress. But this all structures in memory, your heart palpitations, everything. Generalized anxiety disorder. What is anxiety disorder? Too much excessive worry. I cannot control my thoughts. What is happening? So that is generalized. Also occur with other serious mental illness such as heart disease, cancer, HIV, AIDS, diabetes disease. HIV, AIDS, cancer, most of the patients, why? Because 24/7 they're stressed out. They don't know from seek help. You can see each and everything. You can relate. You can have an existence like where it is going. Exactly what is the cause root. So this is the coexist with depression. These are the illness that coexist with depression. Next slide. Okay. So do you have any signs and symptoms? I feel I used to enjoy, but now I don't really now I don't really interest me. Friends and family seem to be like a burden on me. My future seems hopeless. I have hard time concentrating on simple things. The pleasure and joy has gone out of my life. It's an effort to do simple things. Ki I have to do so I'm doing. Otherwise, I'm not feeling internally, I'm not feeling happy to do so. I think about how I will kill myself. I don't sleep well. There is lack of sleep throughout days, throughout nights, everything. Everything is disturbed. I've missed work because I can't get out of my bed in morning. Think when the individual is giving you such hints or complaints, these are the signs of depression. Whenever you get such things, you should recommend those individual to go and consult a psychiatrist, nearby psychiatrist, or any clinical psychologist immediately. Okay, next slide. Okay, what are the causes of depression? Then there are many causes. Depression could be genetic or hereditary. Depression can cause biological health problems. Even if you are diagnosed with depression and you're not taking medications on time, depression is not going to fade away, because those thoughts are there in your brain. Those thoughts are cognitive distortions, are there in your brain. They are not gone. The moment you eat, your dietary, your routine schedule, your environmental, in what environment you are there, it is very important. Whether that environment is healthy, whether you are having some relationship problems with your parents, or whether you're having some relationship problems, interpersonal relationship problems with your uh, boyfriends, or members, or your loved ones. Also, causes of depression can be social cultural factor. Suppose going to accept me if I'm in depression, what will society think? So this all things comes under depression, because person doesn't tends to vent out. So we can also find what are the causes. Situations: is the person around me is good? Is the environment around me is good? Your personality and your relationship. When- Whenever you think that I'm going through this, we need to immediately understand what is the cause. ये डिप्रेशन किधर से आ रहा है? Okay, next. Now, the very important thing is how to cope. As I said earlier, it is okay to have depression, no problem. It is okay to not be okay. So, the very first important, ma'am, next slide. Things, yeah. So, general depression can be loss of loved ones, drug, substance abuse, your lifestyle, and major traumatic events. Students here, everybody, every individual, do not undertake drugs or any sort of alcoholic intoxications or a bad substance. It's very unhealthy for your body, and uh, such individual can go through depression at a very early stage. And whether it is a child, whether it is a teenage, whether it is an adolescent, whether it is an adult, or whether it is an old age. So make sure you have your whole pattern, you have your healthy lifestyle. If your lifestyle is good, if your family is good, it will not cause. But if you're going through any of the stress, or but stress can also create depression. Okay, so how to cope up, we will see now. Now next slide. Yeah, now take depression. First and foremost techniques: don't give up on anyone or any member of your family. The immediate response when you come to know that some of the member or some of your loved one is going through depression, please do not give up on them. Instead, go and communicate. The very important is the moment you communicate, how you communicate. Be polite, be calm, make sure you be empathetic. What is being empathetic? You are there with the person. Make sure that you feel you make that person feel like I'm there for you. Be more active. The more you are active in life, it's like you can, yeah, yeah. Be more active. Be more active is like the do your hobbies, do whatever you love, do whatever you want to do. Do journalizing, do art, do drawing, play with students, uh, do driving, travel and explore. The more you be active, the more it is good for your health. Now face your fears. The very important is do not run away. When you face depression, try to hit that obstacle. It's okay. I can do it. It's okay to be. Instead, you should give yourself command. I am going to face this because it's just healthy. You must intake very healthy, good food, delicious food, fruits, vegetables, uh, no oily and spicy sort of food. Make sure you have lots of protein diets. This can include second, medication. If you take medications on time that is being prescribed to you, you will come out very soon out of it. Have a proper schedule. The moment today, as suppose today is Tuesday or Wednesday, what am I going to do for tomorrow? You need to sit some time with yourself, give some time to yourself, and make a schedule that by 10 o'clock I must be doing 7 o'clock I'm going to wake up, 7:30 I'm going to go for exercise. So you should make a schedule. Improve your sleep. Sleep little early. Suppose I'm having a disturbed sleep. So if I'm having a disturbed sleep, as soon I'm not getting a sleep, but I'm getting a sleep 1 hour before. And what you can do, suppose when you're watching videos, when it's not helping, still you're not getting sleep, you should watch the things that you don't like, or you should do the things that you don't like. What will happen? They'll suppose we will become the brain will become lazy, and when the brain gets lazy, you will get bored by doing those things. You will immediately fall asleep. But then second question is my negative thoughts hits me, and so I don't get sleep. Now for stopping the negative thoughts, we need to control thoughts. But if it is not that severe, if it is light, to ourselves, to everybody who's going through depression, what positive affirmations you will give to yourself is you are loved despite you are sad. You should love yourself despite I'm feeling sad. It's okay, it's going to go away. It's not a big deal. Depression is just today, it's not permanent, right? I will love myself unconditionally, whatever comes. If I'm going through depression, if I'm going through any stress, if I'm going through any mood swing, it's okay. I will love myself as much I was loving it prior. I am strong, I am confident, and my child brings me better opportunities. The more I'm active, the more positive affirmations I give to my brain, the more it works better. Yeah. So for today, the topic was depression, and this is how you can tackle your depression. Thank you. So no one should ever be left alone, whoever it be. Thank you. Yeah, ma'am.
Yes. Thank you, ma'am. It was a very simple
Right.
kind of presentation where it was said it in a very general term which people can understand. It was a very good presentation. Thank you, ma'am. So
Yeah.
there are we are
Thank
having
you.
a question and answer session now, ma'am. So participants, if you have any questions, you can unmute
Sure.
yourself and ask the question, or you can put it in the chat box. I can read it for you. Okay, ma'am. There is a question in the chat box. Uh, it's from Christian Sir, Wellbeing Center. He has asked,
Yeah.
what's the criteria for bipolar disorder?
What is the criteria of for bipolar disorder? Okay.
Yes.
So criteria for bipolar disorder is basically when so have uh, constant changes. As I mentioned, the mood will go up, the mood will go down. Instantly I'll feel sad. Other minute I'm feeling happy. I'm feeling like I'm going to dance. Okay. But suddenly I'll be like irritated. Shit, what is happening to me? Okay. So this is the criteria and the symptoms for bipolar disorder. Next question.
Yeah. I'm waiting.
Sure.
Is participants kind unmute yourself and answer questions or put it in the chat box? Okay, that is I took the question from the same person. Ma'am. So he has asked, when do you decide it is bipolar? It's like,
When you decide it's bipolar, any kind of depression, it's like, suppose if I am having such symptoms and I can see it physically, okay, I am yelling, I am shouting, I am loving at the same time. So frequent changes in the mood, instant changes. Like अभी मुझे बहुत अच्छा लग रहा है, but the second time, if that's bipolar. But if I'm not physically with the person, so the voice may be high, voice may be low. Okay, so that you can come to know, get note at that particular time. Emotions, facial expression change. I'm feeling low, yaar, but suddenly I'm happy. It's like this. So these are sort of expressions of depression, depressive people.
thank you, ma'am. So there's from Satya, ma'am. She says, does it affect the children too?
Yeah, as I mentioned, depression occurs child. Depression can hit any individual, any individual, even the child. The stress can come to anybody, but that we have to figure out what is the stress and whether the person is going through depression or not. So those are the signs and symptoms what I have given over there on the slides. Okay, it can even go through children. Why? Because children today are doing online studies, and continue bombardation of academic studies can lead them to depression. So you can sit there and talk to them. Problem. Are you okay? Exactly what are you going through? Can you tell me something about it? Yeah.
Thank you, ma'am. There is a question from Suresh, sir. He has asked, other than medical approach, is there any family approach available to cope depression?
Support group therapy, very important if somebody is going through depression. And the very important thing is, anybody close individual in the family is there and very supportive, like mother, father, or anything. You can contact family that I'm going through this, please help me, or I want to talk to you. Be in touch with your family, and if not family, your friends, your peer group, your teachers, my dear students, if you all are here, your teachers to whom you're close to, or your school counselors, or your college counselor, or any psychologist. Please go and get help immediately. It's okay if I'm getting negative thought or anything. It's okay to go and get help.
Thank you, ma'am. Another question. Um, is depression of children can lead to personality disorders now?
Didn't heard?
Is depression of children can lead to personality disorder, ma'am?
Hmm. Is depression of children is a
No, can if the children is affected with depression, so will it be affecting their personality? Will it lead to personality disorder? Is the question.
uh, has to do with like adults and somewhere, but in children depression can struck in any way in form of stress. But then when it's a personality disorder, it needs to rule out first whether it's a personality disorder or not, because both are different, both are in different terms.
Yes, ma'am. But children, when they are affected with depression, in the future, when they become adults, will it become a personality disorder, ma'am?
Cannot say that. We need to understand what the person is going through, depending upon the assessment and depending upon the history.
Okay, okay. Thank you for that
Yeah.
wonderful explanation. Thank you. So, and there is a question from Chandra, ma'am. She has asked, how do we know that someone is out of depression if it is mild or and treated at home?
Okay, okay. So in this one question, there are multiple two questions. So may I know exactly What particular question is to be touched upon?
Okay, ma'am. She's asked if a person is affected by depression in a milder way, and it is
Mhm.
treated by in the home itself. How can be sure that the person has overcome depression? Totally is
Yeah,
away from overcome.
true. So what you can do is you can keep a note on the behavior, how the person is to behave first, and how the person is behaving now. Is there any difference in the behavior? Is there any difference in the emotions? Or is there any difference in the way the person is talking or doing regular activities or sort of things? So this is how you can differentiate whether the person is covering or not, or whether the person is internally happy or not. You can be in touch and talk to that person. And once you talk to that person, you should make a note. Each day you should make a note. Today he was feeling happy. So what was his emotion? Today again he was sad or depressed. So what was his emotion? If it is mild, surely he's going to get out, no doubt. But if it in case it is severe, you need to be with that person very firmly.
Yeah, thank you, ma'am. There are a lot of questions.
Sure. I'll take up the questions, no problem.
Yes, ma'am. So there is a question from Kavita, ma'am. How do you help
Mhm.
them come out of depression if the person is
Mhm.
not willing to cooperate with you or opening up? What do we do?
Okay. First of all, may I, Kavita ma'am, may I know the age? Yeah. So first of all, yeah, may I know the age and the behavior? Okay, great. So what you can do is you have the mood swings. So what are the emotions? Whether the person is getting angry, whether the person is stubborn in behavior, whether the person is having too much of ego. Very important. And whether the person has accepted that he wants to get out or not. If these things are not there in the person, and if things are not there, then the person needs to get a problem. Even thinking of help, yes, too much of ego. True. Thank you, Kavita. Then we need to just be where we are. We need to not force any person, because depression or any kind of mental health disorder, there should be an acceptance that I am feeling this. It's okay. I'm going to take help. It's okay. My family is there with me. But if you are giving your 100% and still you are not getting anything out of it, just do your work. Do not force. Let the person be where the person is. Be patient. Accept the behavior, right? No problem. Just uh, using, just be with them. It's up to them whether they want to change and accept, or whether they don't want to change, because we cannot change the behavior, right? And you can, and if there is an acceptance, surely you can talk to any of the clinical psychologist nearby you. I'm sure your question has been answered.
Yes, ma'am. Very true. Whatever you said, ma'am. It's like
Yeah,
only if a person is willing to change, will they change?
mm,
It's not like we force them to change. It never works.
exactly. Acceptance should be there, Lakshmi ma'am.
Yes, ma'am. Thank
Yeah.
you. So there is another
Thank you, Kavita.
interesting question from Chandra ma'am. Some people, interesting, not very
Sure.
important, I feel.
Sure.
So some people do not want to hear others'
Mhm.
problems for it is being a negative thing to them. If it's that way, how to help someone without getting affected in our mind?
Oh, goodness, it's really big. So, can you repeat, ma'am, because the voice is breaking?
Okay, ma'am. The question I just ma'am, if some people hesitate to go and hear to others' problems because that negativity or negative things can affect us. So how can
I'm
we?
not audible. I'm not audible.
Yes, ma'am. Am I audible, ma'am?
How can? Yeah.
Yes, ma'am. So the question is, without getting negatively affected in our mind, how can we help someone come out of depression?
Okay. So, mhm. Okay. So some people do not want to hear the problem. Is this the question by Chandra?
Yes, ma'am.
Okay. negative thing to them. Is that the way? How do you help someone without getting affected? Okay, so yeah, so this question basically, Chandra, what you're supposed to do, as I could see, you are very sensitive in behavior. Okay, and when you are sensitive in behavior, each and everything must be affecting you. What you should do is, at this particular time, you should see that somebody is in pain. And when somebody is in pain, if you really want to go and help that person, you should be mentally prepared to be like in your own stanza. Like, suppose if some of the kid is crying in front of, but if you're very sensitive, even you will start crying. No. What you should do is, you should be practical and strong. It should not let affect you. And if it's affecting you, just tell your mind again and again. Prepare yourself to be strong, because we cannot see some other's pain. And when we cannot see somebody is in pain, we have to make ourselves strong for the other person. Yeah, so it should not be, you should be strong at that particular time. You should be practical and head over heels. I hope I answered your question, Chandra.
Yes, ma'am.
Thank you.
Again, it was a wonderful explanation.
Yeah.
Thank you so much, ma'am. It's really nice. The presentation was really cool, where we understood things, whatever you have said, in simple terms. And also, I feel the question answer session made even more big sense. It was really nice that a lot of questions came and you gave a wonderful answers to that. Thank you so much, ma'am.
Thank you. It was my pleasure to be here. Thank you so much.
Thanks, ma'am. Now I request Dr. Salim sir to propose a vote of thanks.
Thank you, Akshay ma'am, for giving the opportunity for the today's session. It was a very nice session with our resource person, Sanika ma'am. Ma'am,
Thank you,
done
sir.
a wonderful job today. I can
Thank you.
remember that there is a proverb in Japan. They will always say that simple is always beautiful. So on the
Yeah,
same
yeah.
way, your presentation was very simple, and the presentation was beautiful, and anybody can understand the flow, like types, symptoms, and signs, where to go up.
Mhm.
All those things, and the flow was very good, and it was in the alignment, I can say. And the more important thing
Thank you, sir.
today's
Thank you, sir.
highlight is question answer session, man. Lot of different questions, and
Okay.
compared to other days, today lot of questions, particularly today, and then important questions. Since it comes to depression, so all are
Mhm.
very eager to ask the question. I can
Yeah,
find
yeah,
that
very
even
true.
from the Suresh sir, yeah, he rightly asked about the family approach, how to do the family approach, and useful
Mhm.
questions also. Like Chandra ma'am rightly asked how to help other people without affecting our mind. It's a very, very practical. We should help others, but it should not affect our mind. So it was very clearly explained by you, ma'am. So
Thank you.
thanks
Thank
for
you, sir.
presentation as well as the clearing the doubts with
No, it is my privilege. In
simplest
fact,
way.
everybody much.
So I would like to thank you, participant, and today's research, the American College Madurai, Madras School of Social Work Chennai, and MS Chellamuthi Institute of Mental Health, and Department of Psychology, MK University, and our associate partners like Yellow Pond Educational Research Institute, last but not Psycho-Oncological Association of Turkey. Thank you, one and all. Thank you.
Thank you. Thank you, sir.
Thank you for joining us. Thank you so much. Yes, ma'am. We can leave the session. Thank you.